Statistical Significance and Clinical Significance by Somaya, Bhimaya, and Ismael Gestopa. As can be seen in the slide, statistical significance is different from clinical significance. In noting a major difference, statistical significance is where the effect is so large that it wouldn't be due to chance alone, whereas clinical significance occurs when there is less probability that findings were seen due to chance alone. Another way to look at it would be that the effect was large enough to make a change in the client's treatment. The importance of statistical versus clinical significance in research. The importance of statistical significance is it allows the researcher to determine if their findings in research are reliable and valid. The researcher used the p-value and alpha coefficient to look at results of a research study if they were statistically significant. While examining a qualitative study, researchers formulate a null hypothesis stating that there might be a relationship between two variables, or alternate hypothesis which has no relationship exists between variables. If the p-value is less than alpha 0.05, researchers reject the null hypothesis. On the other hand, if the p-value is greater than alpha 0.05, researchers accept the null hypothesis. While the importance of clinical significance is it allows the researcher to determine if their findings are meaningful in clinical practice. There is no statistical test used in clinical significance, but it is calculated by taking the differences between groups. The larger the number, the stronger the beneficial effect. For the example of a relevant literature that employs statistical significance, I am presenting this published paper titled The Effect of Nursing Presence on Patient Satisfaction by Drs. Pinky and Kearney. In this, the authors stress the importance of nursing presence in determining patient outcomes. Nursing presence itself allows for quicker familiarization with patient characteristics and also quicker detection of changes in the patient's health condition that may or may not have significant impact on the treatment or recovery. As can be seen on the slide, statistical significance is employed in the examination of the courtesy and respect and listening demonstrated by the nurses to the patients. The aforementioned factors have been found to contribute positively to patient satisfaction. Patient satisfaction is influenced by a number of factors, and one of these is nursing presence. The paper by Pinky and Kearney states that 15 minutes of nursing presence can already bring about positive improvement in the working relationship between nurse and patient. Communication, listening, and respect have been found out to increase. However, the recommended 15 or more minutes can prove to be rather difficult to maintain for nurses who have other responsibilities to attend as well, which is why it is important that they be supported by their nurse leader when it comes to recalibrating responsibilities. For the example of a relevant literature that employs clinical significance, I am presenting this published paper titled Dementia Caregiver Intervention Research in Search of Clinical Significance by Dr. Richard Scholes. In this, the authors examine literature focused on the impact of dementia caregiving on three spheres. One is health, two personal, and three societal. They state that literature on dementia caregiving have been or are instrumental in the creation of intervention that aim to lighten the burden known to come with dementia caregiving. In clinical significance setup, the practicality of an intervention, like how effective the intervention is when it comes to altering the life of an individual, is examined. There are two main questions that must be answered when considering clinical significance. One is, how important is the intervention to an individual or to society? And two, how large should the effect of an intervention be for it to be qualified for clinical significance? The paper in question employs clinical significance to broaden the understanding on the current status of intervention research on dementia caregiving, and also to examine effectivity of existing interventions that are geared toward improving the lives of dementia caregivers. Now, how statistical significance and clinical significance are utilized. In research, it is vital that statistical significance must first be established before pursuing clinical significance if the results make it possible. Statistically significant difference happens when researchers discover an association or a difference that does not merely comes from chance or normal variation. This means that the probability value, also known as the p-value, identified in a statistical test is less than the certainty level, also known as the alpha value, established by the researchers. A statistically significant difference that is deemed substantial can then go on to qualify for clinical significance, which in turn determines the course of care provided to the public. Researchers must be careful with the sample size as it can negatively affect a statistically significant difference. A sample that is too small would result to an overlooked statistically significant difference, known as type 2 error, while a sample that is too big would result to a difference that does not exist, known as type 1 error. Here are the references.